and the conversation. Liz, back over to you.
And I would like indeed to welcome Jarek to the floor, please, for this conversation about the power of pandemics to change the world. So I'm very happy to introduce to you this speaker for the next session, Mr. Jarek Waligora, Deputy Head of the Health Security Unit of DG SANTE. And I think it's even much more appreciated that you're with us today because you're standing in at very last notice for the Director General of DG HERA, the new authority that deals with health security, who couldn't make it last minute for private reasons. So Jarek, it's even more appreciated that you're with us today. And we're very much looking forward to a conversation about the role of EU health and health security post-COVID, because we have been discussing a lot the EU's role also from a global perspective. And we have seen with COVID-19 that, of course, the role of health became even more important. So we agreed that we would have a conversation this afternoon about the EU's role in health, but also the EU's role in global health and health security. And we decided, perhaps also for the sake of the audience, to briefly look back about what was exactly the EU's response, but perhaps even more important, what does it mean going forward? Because we probably know that health always has been defined as an area where there is some cross-border element of health policy, but a lot of people consider health policy still as defined by national healthcare systems. So Jarek, perhaps if we can go back to the start of the pandemic. We spoke earlier today about the need for EU unity and solidarity. I still remember that the very first reaction of EU member states wasn't necessarily one out of solidarity. It was more a knee-jerk reaction where borders were closed. Member states were thinking initially themselves about how to jointly or perhaps with a little group of member states get to research in vaccines and get these vaccines eventually. And the joint procurement as a whole, where the Commission was tasked to come up with vaccines, that was later. So if you look back at the initial response, could you say a bit more about how that worked and also about the additional competences that grew over time?
Yes, thank you. Good afternoon. Indeed, I mean, this was not, of course, very easy moment for the EU and for the EU health policy. But it started all, as you just said, it was not very the response was not really based on solidarity. The first initial, let's say, impulse was not like that. But what was in place, we actually had already quite good legal basis for our health security policy at that moment. So it was something to start from. And even if the health in general is, as you say, not very high on the policy agenda in the EU always, I mean, it was not before COVID crisis. We had this legal basis which actually helped us to offer that possibilities to change that initial impulse, which was probably very natural as well for member states to look inside their countries, how they can secure the health of their societies. But then we had the tool for joint procurement, which was there. It was a bit dormant, I have to say, because it was not very much used, but it was there and it helped us to actually then to offer that possibility. And as well, together with member states, they realized very quickly that if they go for this approach, as you mentioned it, very nation-oriented and not European-oriented, this would not lead them to achieve even their goals at the national level. So that was, I think it was very pragmatic as well from the perspective of member states to change their approach and to go for this solidarity approach, which actually helped us to buy vaccines together, to go for joint procurement, to go for joint purchases of vaccine. That was critical moment, I would say, for the pandemic. But But it was not only about vaccines, because I mean, everybody is talking about vaccines, but I want to give you as well one example about health workforce, because some member states, they are dependent as well on the workforce coming from other countries. And I live in the small country, Luxembourg, and Luxembourgish authorities, in fact, a few weeks ago, we had a very big conference in Luxembourg on lessons learned from COVID pandemic. And one of the conclusions as well, and the message from Luxembourg to other countries was that actually they really thanked the other countries that they haven't shut down the borders, and they thought about workforce which is coming from Belgium, France, Germany every day to work in Luxembourg. And this was the only possibility for them to sustain their healthcare system. Otherwise, it would collapse in days, because if I'm correct, 60 to 70% of that workforce is coming from abroad. So that was really critical. Solidarity is really critical.
And how about the role of the EU agencies? Because I remember from a previous capacity, when at the start of the pandemic, I was dealing with the European Centre for Disease Control. We were asking them the rather basic question, so we thought, about prognosis, about the numbers of patients involved. I remember them saying that after a few weeks, they only could come up with retrospective data. So clearly they weren't equipped to deal with these crises. They didn't have the numbers, the resources. In terms of the additional competences they got, are they better placed right now to deal with pandemics or cross-border threats going forward?
They were, of course, in place, so that was good. They collected data, but as you said, these data were not always up to date, and these data were not helping us to take decisions on the daily basis. That was the major problem, that we had actually systems between ECDC and member states, and they are operational, but they are not to the speed of pandemic. So that was very important, and of course, this is one of the first lessons learned from this pandemic, that we have to strengthen our agency, we have to strengthen ECDC, we have to strengthen EMA, and these two agencies are actually very pivotal for our response, and they actually acted. They started to adapt to the new situation. They started to adapt to the pandemic. They started to invest in new tools, to create new tools which were needed, like, for example, EMA established task force, which was needed. They have not so much legal basis for that, but they invented those tools to really support member states in the need for their scientific advice. As well, the same for ECDC. They speed up their processes. They change the way they collect data, how they present data as well, because it's not only they role to feed this data into policymaking, but as well they role as well to inform society about number of infected people, number of people tested, but as well number of hospital beds available in the hospitals. And this is something that we actually immediately thought about, and this is the first outcome, that we have now changed the mandates of those two agencies, and actually in those new mandates now, these tools which were developed during pandemic time, and that the need of those tools actually emerged during pandemic, they are already there. So when it comes to the next pandemic, hopefully not very soon, we will be definitely better prepared. But agencies is the one thing, and the renewed mandate is very important. We of course have HERA as well, as you mentioned. HERA is going to work mainly with
Just
the countermeasures.
HERA is the Health Emergency Rescue Authority, if I say that correctly. So it's the new agency, in case you hadn't noticed, that the EU now has. It's part of the European Commission that deals with pandemics. Yeah,
we had very lively discussion about how HERA should be structured. There was indeed idea to have HERA as a separate agency. Now HERA is a part of the European Commission, is one of the Commission DGs. But HERA is mainly going to work with the availability of countermeasures, so availability of medicinal products, availability of vaccines, and their development. But the whole health security policy with epidemics, preparedness, planning, response is actually in DG SANTE and in ECDC and EMA. And so we mentioned, just mentioned as well, one additional lesson I said about these two agencies and their renewed mandate, but as well what is in the core of that what we've learned from the pandemic is the new regulation on the serious cross-border threats. And this is what gave us that power to act at the beginning. That was decision which we had, but this decision was now renewed and will be into force in coming days. Then ahead of us is the big process of implementation of that regulation in the next few years, together with our agency, together with member states, together with other actors as well globally.
Another element that I'm keen to touch on is the EU's interdependency on other parts of the world. And especially if you think about the geopolitics of the fact that in the beginning of the pandemic, we were reliant on China for masks. Going forward, for example, when it comes to antibiotics, we know that these are hardly produced anymore in Europe. So what are the lessons learned there? And where is the current thinking of the European Commission in terms of what the Commission and what Europe should do in terms of health security?
Obviously, we realize as well that when the global chains were disrupted, that we actually are very interdependent in as well in terms of health policy or in health for example in the countermeasures, medical countermeasures. So this is something that that our colleagues in EMA and HERA they're actually working on that as well, and to ensure that we can have necessary medicines in Europe. It's not to block all cooperation and not to stop that, but it's really to ensure that what is needed as a basic needs, they have to be ensured and without any delays, in fact, because this was something that actually caused a lot of problems. It was not even that we stopped that collaboration during COVID, but delays in those production chains caused those problems in having medicines in Europe. But maybe that would lead me as well to the more global dimension of the whole security in general. And as I said already about our own environment here, which we trying to re-establish now with all those changes in legislation and new implementation of certain specific tools, but as well the COVID pandemic was a trigger as well to change the whole global health architecture, and we see now discussion on this global aspect where Europe is very active as well with its global health strategy adopted just yesterday. So this is really happening now, and Europe is as well very active as member states, but as well as the European Union in discussion on the new pandemic agreement, and as well which is going to be a new tool for global health security, and of course how these two will interact in Europe. It's very important for us. I mean, we have to ensure that we are not duplicating things. We have to ensure that when we collect data, these are data which are used both globally and here internally in Europe. And in fact, we can as well use our experience, our power, European power, to as well set some standards with our agencies for data collection, for making those decisions in health security area, which is not, by the way, only about biological threats, but it's as well about chemical threats. It's as well about environmental threats, which we heard before. And actually our approach now is going more into that, that we are trying to treat those threats together. And this is in fact One Health approach, which is core of that new legislation and core of our thinking into the future.
I will come back to the One Health approach later on, because I think that's very interesting indeed. But I would like to go back to what you said about the global health strategy, because indeed that has been presented yesterday. So it's very new, very fresh. What are the additional tools that the EU now has with the global health strategy? Because if you listen to the skeptics amongst us, they would say, well, it's all great that we have it now, that we will have a pandemic treaty, but there is a lack of enforcement. So it's great to have them, but these are, as some say, paper tigers. It will not really lead to better coordination in case of future pandemics. So are there new tools that the EU now can use?
Oh, it's not only you, of course, but globally we have these tools and they are now in place. And these are international health regulations, for example. That's the main tool for the international health policy and global health policy. And this is something which is going to be as well, let's say, improved or amended after pandemic. And discussion on how to do that is actually ongoing in parallel as to the pandemic agreement. And pandemic agreement as well is going to have some binding and non-binding agreements within it. So these tools are actually embedded there in the document which is discussed now, but as well it is not going to replace what is already there, working well and delivering, which is international health regulation.
I guess it's very hard to ask you for your opinion, but the reason for asking my previous question was that I was seeing a draft text for the global pandemic treaty that's being negotiated now. And it made me slightly smile, I have to say, when I read that apparently the draft text states that if deemed appropriate, we could address cases of non-compliance. And again, there you go. If there's an upcoming pandemic, a next pandemic, and if there's non-compliance, again, do we have a better situation compared to the current? And again, I would love to have your opinion, but I can also understand if it's very hard for you at this stage because it's draft text.
No, it's draft text. Of course, it's under negotiation and I don't even know from which paragraph it is coming. But it's obviously the negotiation is there, and hopefully we will have more those binding agreements in the text, and this will help us. But what is really important is the whole process as well. I mean, because we have to, we are talking in our legislation now, in our regulation, and the core of it is planning, and it is planning for preparedness and response at the EU level, but it's as well planning at the national level. It is super important, but the plan, of course, will be there. But what is, in my opinion, personally very important is the whole process of planning. And this will help us to establish those tools which will stay there. And the plan, of course, it's a document which is good to have. But I think the whole process and putting those tools in place, making them ready, this is really, really super important. And this will happen as well at the global level.
Before I go to the audience, so please think about the questions that you may have. I would like to come back to what you said about the One Health approach, because it's true that since the pandemic, we have become much more convinced of the importance of having a holistic vision on the links between planetary health, human health, but also social economic elements of it, and really have a more holistic vision on all of that. And a few years ago, I think as a way to stress the importance for the Commission approach, DG SANTE announced a new structure where indeed One Health now becomes essential for your internal way of working. And you already mentioned that indeed you will look much more about the correlation between environmental threats, chemical threats, biological threats, and the relation and the impact on health. Can you say a bit more on how that, let's say, practically works for the Commission?
Yes, maybe just few examples. Definitely, this is approach which we are taking now, and globally, this is approach which is very much promoted, and it's based actually on evidence. So we have to understand that biology is not only for humans and it's not only for animals, and as well what is happening in environment has an impact on us and has an impact on animals. And just to take viruses, they are not circulating only in humans. So all those diseases and emerging diseases we see, they actually are, many of them are zoonotic diseases, or these are viruses which scientists know for years that they are infecting animals, but they are just switching to humans at some moment. And that's why if we think about that as a one system, then we can actually better approach those potential epidemics in the future. This is about generating knowledge, funding research, but this is as well about development medicinal products. When we think about developing some medicinal products for animals, or we think about humans, of course, but we should think about this as a continuum. I mean, the same products sometimes are used for animals and humans. The same should be as well for the future when we think, for example, about vaccines. Why we should think about splitting those two things? I mean, if biologically they are very, very similar, if not the same. And for antibiotics, similar situation. We use antibiotics for animals. We use very similar antibiotics for humans. And in fact, if we don't adapt how we use them both for animals and humans, this is actually triggering a lot of antimicrobial resistance. So we have to link these two. And environment here is as well very important, because those medicines are released as well to environment, so they circulate there as well. And how we do that, this has an impact on us.
I'm looking to the audience. Are there any questions? I see that Jackie is already to hand you over the mic, and I'm trying to see if there's any hands up. I see Ricardo.
Meet you in the middle, Ricardo.
Thank you. I mean, just had a very quick question, and I don't follow this area, so closely as both of you do. But one of the problems over the last pandemic is that every time a country would report either a new variant or would be transparent, which is something which is a key principle, as I understand, to be able to fight a pandemic, this country would be immediately penalized. We have the case of South Africa where, flights were immediately canceled. So and this is a disincentive for countries to be transparent about this problem. So is there any system that has been thought out globally to be able to support, to help, overcome this difficulty? Thanks.
Yes, of course. I mean, it's very, it's not an easy question, not only because from the policy perspective, but it's not easy question as well from biological perspective, because there would be probably huge differences between different biological factors if you think about them, how they spread, but yes, indeed, we of course face that problem, and if you want to hear my opinion, of course, these countries should not be penalized, because they are actually sharing openly information with the other countries about these new variants, and this actually helps other countries to better respond to this variant. So this is something that we have to discuss, and this is actually discussed, and more. Countries are trying to tailor their response to those biological problems, to make it more evidence-based, and not less, let's say, less political reaction, but more based on science. And in many cases, actually, those variants are spreading very quickly. So this is not something that would help us to stop that variant completely. That would probably be not possible. What we can only do in case of some very severe variants. I'm not talking about COVID, but in general, that might actually help us to slow down a little bit spread of that variant. But this is very important. This is very important because we have to collaborate. We have to actually encourage scientists, encourage countries to collaborate better, to be transparent, to trust each other. And this aspect is very important for response. But if we have that trust, if we think about that earlier, then it would be easier as well to find a right response and to tailor it properly and not to overreact. So this is very important.
Well, thank you, Ricardo, for the question. And certainly it links also to the role of the EU in the G7, G20, where, of course, always the EU had been active. But I think, especially with the lessons learned from the pandemic, the EU's role has now been reinforced. In light of time, because I'm conscious that I have Jackie's eye on me, so I think we're going to go to the last point of our conversation. But personally, I'm keen because also today, as you very much can understand, we have been speaking a lot about the impact of the Russian invasion in Ukraine. And I know that also the European Commission as such, but also you in DG SANTE have been stepping up your activity when it comes to coordinating with stakeholders, but also when it comes to transferring patients from Ukraine. Can you say a few words about what you practically are doing and how you do that as DG SANTE?
Oh, yes, of course. I mean, you can imagine that the healthcare system in Ukraine is under huge pressure now, and both because of disruptions in the war, but as well because of the injured patients there. So we have constant communication with the Ukrainian Ministry of Health, but as well we are coordinating as well that response and help to Ukraine via our existing structures, which are actually created for health security. We have Health Security Committee where we have representatives of all member states, and they are meeting. They used to meet not so often, I have to say, before pandemic, but since pandemic started, they are meeting once a week or even more often. And one of the topics they are discussing is as well how to support Ukraine and how, for example, to transfer patients from Ukraine to member states, to treat those patients in the member states where they cannot be treated in Ukraine. And one of the tools as well we used is our electronic IT system, which we have for security, which actually proved to be very good for COVID, but as well it proves to be good as well for other health security incidents like that one in Ukraine, and it helps us to coordinate between member states and Ukraine now, and help better patients in the Ukraine and bring them, if necessary, as well to EU.
Well, thank you so much, Jarek. I think this has been very interesting. At the European Policy Center, we have a project going on about European Health Union, and we study a lot of the elements that you mentioned this afternoon. So many, many thanks for your input. So I would like to ask the audience to really thank me for your intervention. Thank you.
Thank you very much.
Thank you also to you, Liz, for masterminding that conversation so masterfully. So in all our conversations,